Namaste, good evening. This is Dr. Aparna. I am an Ayurvedic psychotherapist. I am your emotional healing synergist. I am a passionate Ayurveda and psychotherapy infopreneur and a medical writer. Today's topic of discussion is again adolescent mental health. In the last session, we were discussing about adolescent mental health. Today, we are going to discuss about eating disorders in adolescents. So, as we discussed in the previous session, childhood and adolescence are critical stages of life for mental health. So, this is the time when rapid growth and development takes place in children, takes place in the brain. So children and adolescents acquire cognitive, socio emotional skills that shape their future and mental health and are important for assuming adult roles in the society. So, in adolescence, mental health is typically characterized by a roller coaster of emotional and psychological highs and lows. Most of us know this. So, intense feelings are a normal and healthy part of the psychological landscape of youth. But it is also true that many mental health disorders of adulthood begin in childhood or adolescence. So, adolescent phase is very much crucial. So, to discuss today's aspect, that is eating disorders in adolescents. So, eating disorders are serious mental health conditions. They are characterized by abnormal eating patterns, eating behaviors, and an unhealthy preoccupation with food, with weight, and with body shape. They have an unhealthy preoccupation with the food, with the body image, with their weight. So eating disorders are common among children and adolescents. So they have excessive concerns for physical appearance. Adolescents, that means teenagers, have excessive concerns for physical appearance and distorted body image. And they usually fear, gaining weight. They have a fear of gaining weight. So they often develop, during adolescence and young adulthood. All these fear and concerns develop during the adolescence or young adulthood. So impacting a significant portion of the global population. These eating disorders are impacting a significant proportion. So, what could be the causes? So, there is no single cause for eating disorder. It could be a combination of factors, biological factors. Genetics can, play a role, making some individuals more susceptible to eating disorders. So there could be some psychological factors, low self-esteem, anxiety, depression, and perfectionism. These can all contribute in, eating disorders. Social factors. So social media pressures. These days it is very, high and very prevalent. So unrealistic beauty standards and bullying, cyber harassment, all these about the weight, about the body image can be the triggers. And the familial factors as well, the family factors, a chaotic family environment, critical comments about weight, or pressure to be successful, all these are risk factors in life. So, the global incidence of eating disorders. Eating disorders are a global public health concern. So, the eating disorder usually affects millions of people worldwide. So, prevalence, it could be up to 5% of the population may be affected by an eating disorder at some point in their lives. So onset of, age of onset could be most cases develop in adolescence and young adulthood with a peak around 13 to 18. So while eating disorders can affect anyone, usually the gender, females are diagnosed more frequently, with eating disorders, and males are also less to seek help about it. So what are the, if I have to talk about different eating disorder, most common types of eating disorders, so there is something called anorexia nervosa. So anorexia nervosa is, in this there is severe weight loss or an inability to gain weight expected for their height and age. Why? There is an intense fear of gaining weight or becoming fat even when they are underweight. So they have, fear of gaining weight, fear of becoming fat, because they have a distorted body image, because they see themselves as overweight even when they are underweight. So denial of seriousness of low weight, restricting food intake, skipping meals, or eating very small proportions. So, excessive exercise could also be a reason, and amenorrhea, absence of menstruation in females, could also contribute. So, dry, brittle hair and hair loss, brittle nails, difficulty concentrating, and feeling cold all the time, and social withdrawal. So, these are all the signs and symptoms in anorexia nervosa. So, what is the impact of anorexia nervosa on physical health? So, we can see malnutrition, we can see muscle wasting, weak bones, that is osteoporosis, heart problems, that is irregular heartbeats, low heart rate, low blood pressure, kidney problems, gastrointestinal problems, gut problems, constipation, bloating. There could be nervous system problems like seizures. In severe cases, this is not very common, this is rare, but death is also, death may also happen because of anorexia nervosa. So, impact on mental health. On mental health, anorexia nervosa can cause depression, can cause anxiety, can cause OCD tendencies, that is obsessive compulsive disorder, can cause social isolation, could also lead to low self esteem, could lead to difficulty sleeping, or changed sleeping patterns. So these are all the signs and symptoms and impact of anorexia nervosa. Second, prevalent eating disorder is bulimia nervosa. So bulimia nervosa is a kind of eating disorder. So signs and symptoms here is repeated episodes of binge eating. So these guys, in contrary, they consume large amount of food in a short period with a feeling of loss of control. They always binge eat. If they eat chips packets, they eat 3 or 4 packets at once, or even more. If they eat pizzas, they eat more and more pizzas. So repeated episodes of binge eating. So they have purging behaviors after binge eating. So that could be self-induced vomiting, laxative abuse, diuretics, enemas, and excessive exercise. They also might have purging behaviors, you know that is self-induced vomiting or something like that. And calluses on the knuckles, so knuckles that are red and swollen from frequent vomiting. They could have worn tooth enamel from vomiting. They could have dehydration. They could have electrolyte imbalance, which can lead to heart problems. They could have irregular bowel movements, that is diarrhea or constipation. So they could have fluctuations in the weight, increase in weight, or maybe decrease as well. They could have swollen salivary glands. So, how does bulimia nervosa impact the physical health? So they have damaged teeth and gums. So they have esophageal problems, they could have tears, ulcers or tears in the esophageal region. They could have irregular heartbeat. They could have electrolyte imbalance, which can lead to heart problems. They could have kidney problems. They could have dehydration, chronic sore throat, gastrointestinal problems like constipation and bloating. So how does this impact on mental health? So it could have, he or she could develop depression, anxiety, again low self-esteem, difficulty concentrating, and the guilt and shame after binge eating episodes. This is not only binge eating, they also feel guilt and shame. That's why they puke, that's why they voluntarily vomit. So all these things, so this is called as bulimia nervosa. The next is disorder is, this is most prevalent, so this is called binge eating disorder. This people would have heard of. This is different from bulimia nervosa because here they do not self vomit, or they do not have purging activities, which were their purging behaviors are not present here. So in binge eating disorder, recurrent episodes of binge eating, that is consuming large amounts of food in a short period, so they lose control of how much they are eating. They are not mindful of eating much faster than usual during the binge episodes, eating until they are uncomfortably full. So eating large amounts of food even when they are not hungry. So eating alone due to embarrassment about eating habits. They are embarrassed about their eating habits, but still they prefer eating. They can eat while they are depressed. They can eat while they are angry. They will eat while they are embarrassed. So, and feeling disgusted with oneself after eating, they feel disgusted with their self. They feel depressed. They feel guilty, and then again they start binge eating after all that. So, what is the impact on physical health? So, majorly, as we can predict, obesity and weight related health problems such as type 2 diabetes, heart disease, high blood pressure, all these things, high blood cholesterol, intestinal, gastrointestinal problems like heartburn, acid reflux, indigestion, constipation, bloating, all these problems, and sleep problems. They might sleep excessively, or they might have difficulty in sleeping, so disrupted sleep patterns. So what is the impact on mental health? So they could suffer with depression, anxiety, again low self esteem, shame and guilt, difficulty concentrating, again social isolation because of their weight and binge eating habits. So, and we this is binge eating disorder. So eating disorders are complex mental health illnesses, and seeking professional help is very much important for recovery. If you suspect someone may be struggling with an eating disorder, encourage them to talk to a doctor, therapist, or a registered dietitian specialized in treating eating disorders. So how can we prevent you know eating disorders in adolescents? While there is no guaranteed way to prevent eating disorders, so what we could do is promote positive body image. So focusing on overall health and well-being rather than just the weight and physical appearance. So challenging unrealistic beauty standards portrayed in the social media. So, and celebrate the body diversity and encourage appreciation for individual strengths and talents. So we have to celebrate the body diversity. We are not, all are not equal, we are all unique, so we'll definitely have diverse bodies. So modeling healthy body image by avoiding negative self talk and criticizing your own appearance. So and also developing healthy eating habits, so eating regular meals, as a family involve, what parents can do is eating regular meals as a family whenever possible, involving, adolescent or teenagers in meal planning and preparation. So this empowers them to make healthy choices. Focus on a balanced diet rich in everything: fruits, vegetables, proteins, grains, cereals, pulses, everything. So, avoid restrictive diets or labeling food as good or bad. So, this can foster unhealthy relationships with food. So, practicing mindful eating, that means by paying attention to hunger and fullness, this is very much important. And then what we can do is, as parents, you can promote open communication, so creating a safe space for open discussions about body image, weight concerns and emotions. So listen actively to the teens without judgment and validate their feelings. Okay, you're feeling like this, so it could not be like this, it could be like this. So challenging their negative thoughts about food, weight and body shape, and talk about the dangers of eating disorders. So you have to be aware, get your, you have to have the knowledge of eating disorders, get, enough awareness, and then you talk that to your teenagers. And you have to know the importance of seeking help whenever it is needed. Early intervention is always better. And always encouraging healthy coping mechanism, developing stress management techniques like exercise, meditation, relaxation techniques, mindfulness practices, creative outlets, skills, new hobbies, new sports. Promote healthy social connections with supportive friends and family. So encourage participation in activities that boost self-esteem and promote a sense of accomplishment. So encouraging participation in, different activities, in skill development activities as well. So to, teach your teenagers or your children, you have to be a role model first. So you have to model healthy eating habits and a positive body image yourself. Avoid criticizing your own appearance in front of, at least in front of your adolescents, and talking negatively about the weight. So promote self care by taking care of your own physical and mental health. So early intervention is always better. So be aware of the signs and symptoms of eating disorder in adolescence. So and seek professional help, either a doctor, either a dietitian, either a therapist, either a counselor who is, good at treating eating disorders. So early interventions, as I said, can significantly improve the outcomes. So this is about, eating disorders. So, in the next, we will discuss some other disorder pertaining to adolescent mental health. Thanks for watching. Stay tuned for more information. You can put in your queries, your thoughts, and your concerns in the comment section. Thanks for watching. Namaste.